MHI relies a lot on MedInsight for any of the reporting and the analytics that we do. And we use it in a variety of ways. We publish public reports that are about population health and the community, so prevalence of chronic disease. In St. Louis and Kansas City, Missouri, we are also reporting on facility metrics, so inpatient and outpatient facility utilization and market share reporting. And we do disease state-specific reports as well. So many of MHI's partners are interested in migraines or diabetes or chronic kidney disease, and they are seeking a regional perspective of what that looks like in Missouri, and then some of those metropolitan statistical areas within the state. And so we will release infographics or reports to help support them and their relationships with employers. A lot of what we do is driven by those self-insured employers. And so we're not necessarily using MedInsight to identify ways that costs can be cut or how can we manage finances, but we're also looking at really population health. How are we able to identify the prevalence of certain disease states? How can we make movement with that in our community? We also use the HCG groupers a lot to look at utilization and how can we drive change in ED utilization, not from inside a healthcare organization, but from a larger community perspective by bringing those healthcare providers to the table along with the plans to make change that can help our self-insured employers manage their plan members as well. MedInsight and the entire MedInsight team that works with MHI really assists in the specific provider attribution that MHI does. So MHI has a custom provider attribution logic that we use for primary care attribution, and MedInsight has allowed us to actually apply that within the data instead of having to pull it and then apply attribution post processing, basically. And what that looks like is, working with providers in St. Louis to identify different areas and specialties that should and shouldn't be considered primary care based on what our region considers to be those primary care specialties. And then another large piece of MHI's operations related to provider attribution is our master provider list. And MHI collects rosters from the local health systems in St. Louis very regularly so that we can have the most up-to-date information on who the providers are within each of their medical groups. And then we also ask those health systems and medical groups to identify whether each of those providers is working in a primary care setting or not, which assists a lot with attribution of physician assistants and nurse practitioners, because that always doesn't come through in their taxonomy codes. And so MedInsight is going to help us take that master provider list and piece it together within MedInsight so that we can look at our specific medical groups in that way. Using that master provider list and the provider attribution specific to St. Louis helps the providers have more confidence in the work that MHI is doing because they've contributed to that custom attribution logic, so that if we're reporting on total cost of care for primary care provider groups, they know exactly who is considered to be a primary care provider in that case. This year, we added the Kansas City Health Stats Scorecard, and with driving change or initiatives in other regions for employers, we're really just at the beginning of this. So MHI has had a large presence in St. Louis since we began the organization, but we've had less of a presence in other areas of Missouri. And so right now, with the scorecard expanding to Kansas City and Springfield, we're really elevating discussion about the commercial population, and bringing awareness to the fact that we have this data asset that can be instrumental in helping self-insured employers to make plan design changes and inform community health. So we're in the process of communicating it right now, right? And it, by pairing not just the report with a release on the website, we're really working to communicate through press releases, social media posts, so that we can call attention to specific concerns that we see from the scorecard. If MHI communicates our use cases and our needs to them, the MedInsight team is extremely responsive, and they make sure that we can hit our deadlines and that we can get the changes made that we need to get our deliverables done. We continue to work with MedInsight because of the partnership that they create with us. It is a shared commitment to improving healthcare, and MedInsight's willingness to work with a client like Midwest Health Initiative that is using MedInsight in a different way than it maybe was developed. Looking forward to the future of Midwest Health Initiative's partnership with MedInsight. I am really excited about the ways we're going to continue using the innovation portal in our reporting and our analytics workflows. It has opened up a lot of doors for us, especially with a small team. And I feel like we've just broken the surface of what we can do with that. We're also looking for ways to continue population health reporting, ways that we can specifically support self-insured employer clients in informing their plan design changes, and looking forward to working with MedInsight on some of those ideas.